So, doctor, I wanted to talk about premature ejaculation. This is a problem a lot of men have. They don't talk about it. It spoils relationships. They don't have the confidence to discuss it with their partners. How do you handle these cases?
Great question, Luke. So remember this, 30% of men suffer from premature ejaculation. That is a lot of men. That is a lot of men. And only 9% will seek some kind of medical therapy. And so that's very concerning. So when a man comes in with premature ejaculation, you have to ask yourself one simple question. Is this acquired or lifelong? And in both cases, they have to have three criteria. One is that they have to have at least be bothered by the situation. If they're not bothered, it doesn't matter, right? Secondly, they had to have a loss of self-control. They tried to control it, but they couldn't. And third, there's a time factor. And typically we will say less than 2 minutes. So if they ejaculate less than 2 minutes, that's an issue for the lifelong. If it's acquired, it's 50% of what they're used to. So if they say, I used to ejaculate in 20 minutes and now it's 10 minutes, it's a problem.
In your experience, after seeing so many patients, what do you think the top three reasons are that men have this problem today?
Well, there's four reasons. So we talk about biological, neurobiological, we talk about psychological as well. And so the main thing is some patients can develop a hypersensitivity of the penis and the glands. That's what they have. So they need the numbing medication. Neurobiological means that the serotonin is too high in the brain. So that can be an issue. Too low, because that's when it causes premature ejaculation. And then psychological, you cannot discount that some patients have a anxiety with the relationship. They have a new partner. Something is bothering them, that's bothering them. And then the fourth one, there actually is a genetic component, believe it or not, with premature ejaculation, a small percentage. So those are the four main causes. The best treatment, one of the best treatments is sex therapy. But most of my patients say, I don't want sex therapy. I don't have the time. I just give me a pill. But sex therapy, because remember, the mind controls the ejaculate. So they can teach you techniques. We teach the start-stop technique, the squeeze technique, many techniques. That to me is a cure and better than a pill. But if a man says, I don't want to do the sex therapy, give me something else, we say, okay, the simplest thing you can do is a numbing spray. These don't need a prescription. It's a lidocaine spray that places on the penis. It numbs the penis, and then it prolongs ejaculatory time.